All right, now, let's go. What have we talked about so far? Okay, the cardio system. All right, the heart. What have we talked about the heart? Talking cardiac cycle, right? The sequence of events from one heartbeat to the next. What else? The ECG, right? We spent, what, 2 weeks, 3 weeks on ECG, and now we have become master ECG readers. Okay, that's good. No, and you know what I like about your batch? When we did the ECG lab, you actually had a very high level of suspicion from your classmates. You're like, this is the right bundle branch block. No, those like one. Those like one, but probably not. Okay? Remember, there are such things as non-specific. When you say something's non-specific, it means that you see an abnormality, 1E or A2, but they don't fit into a particular criteria. Right? Remember, for right bundle branch block, left bundle branch blocks, what two things do we look at the most? D1 and D6. Guys, weekend, you already forgot. Okay, study carefully because for the long exam I'm going to ask questions like that, alright? Now, so going back again, in retrospect, if you look at what we've studied so far, we've concentrated on the heart. Okay, the heart is a pump, the mechanical workings of the heart, and then we went on to ECG, which is the electrical working of the heart. But once the heart pumps out that blood, where does it go to? Different regions of the body, very good. The vascular system. So now we're going to talk about vascular system. Note that the vascular system, especially when we go to the next meeting, when we talk about regulation of the vascular system, the heart is actually also affected by things that happen in the vascular system. Remember the triad I taught you about vascular system? About clotting? What was the name of the triad? Virtuous triad, right? In virtuous triad, what were the components of virtuous triad? Stasis, right? What does stasis mean? Turbulence or stoppage of blood flow. What else? Hypercoagulability, meaning that there's a defect in the coagulation system of your blood. What else? Endothelial injury. Now you may be thinking, what the hell is endothelium? We'll actually learn here, right? That there's a layer of cells, what we call the endothelium, which lines your blood vessels. And anytime that is injured, it will actually cause, okay, disseminated clotting as well, right? What was the disease called? Disseminated intravascular coagulation. So we talked about that really briefly. Alright, so let's go to the vascular system, not to keep you. By the way, next Thursday, I need you to get a lot of sleep. Why? Because we probably go up to 5. We're talking about the whole vascular system on Thursday. But, as a reward, I'm giving you next Tuesday off. Alright? So next Tuesday, you're off. And then next Thursday, it will be the long exam, the module exam for cardiovascular physiology. Right, going down to the vascular system. What are the things we need to know about the vascular system? First, we need to know that, of course, we're talking about blood vessels, right? And not just blood vessels. When we go to the topic of microcirculation, we're also talking about lymphatics. What are lymphatics? We'll find out when we go to microcirculation. So when you look at the circulatory system, you're actually talking about 2 circuits, right? 2 circuits, namely your pulmonary circulation and the systemic circulation. Also, okay, these are composed of your veins, which carry your high oxygenated blood, and your arteries, which carry your oxygenated blood. What are some differences you can see here? What are differences? Okay, if you notice, entrance and exit. Alright? Entrance and exit. Note that the entrance of your pulmonary circulation, what type of blood enters the pulmonary circulation? Dioxygenated blood. Right? This is blood that comes from different parts of the body that needs to be oxygenated. Then exit your oxygenated blood. Now, for the systemic circulation, it's the other way around. Okay? It is dioxygenated blood that enters through what vessels? What are these two vessels called? The great veins or the vena cava, right? Composed of the superior and inferior vena cava. Very good. So it enters there through the right atrium, goes into the pulmonary circulation, exits through the left atrium, left ventricle, and then it is oxygenated blood that exits your circulation. Right? Now, another thing I need you to note. Right? Sorry, this is your entrance. Yes. Alright, it's oxygenated blood that enters the circulation. In the pulmonary circulation, it's the other way around. That oxygenated blood enters. Let me ask you this question. Which of the following has the highest pressures? The systemic circulation will have a higher pressure than your pulmonary circulation. We talked about that in the cardiac cycle, right? So also note that when we also talk about capillaries. Well, what are capillaries? Capillaries are your smaller or smallest blood vessels you have, right? And these small blood vessels are where oxygen is usually unloaded to the parts of your body. Trachea. If you spread all of your blood vessels, right, you make one whole line of your blood vessels. Note that if you piece all of your blood vessels together and make one whole straight line, this will cover 60,000 miles. Wow, you're like, whoa, really? Yes, there are 60,000 miles worth of blood vessels inside of you. That's if I dissect you and take all of your blood vessels and put it straight ahead. So 60,000 miles worth of blood vessels. Okay, now go into the structure of blood vessels. Right, let's just go quickly into the anatomy of your blood vessels. Note that for the artery and the veins, both of them have a tunica intima. This is your endothelial cells. Your tunica intima is your endothelial cells. This is the one that's stated in Virtue's triad that if there's any injury to these layer of cells, to the tunica intima, you will have clotting, abnormal clotting. Note that both artery and veins also have elastin. What's elastin? It's a protein that enables it to be elastic. That's why it's elastin. Now, tunica media, this is your smooth muscle. Note that your artery and your veins both have tunica media, smooth muscles. However, we'll learn later that different types of arteries and different types of veins have varying amounts of elastin and tunica media. Meaning, some have more elastin and some have less smooth muscle. Now, the tunica externa is the loose fibrous connective tissue which acts as a protective covering of your blood vessels. And there is also an extra layer called your serosa for the epithelial cells of your artery. Take note that the presence of extra layers in your artery is what will affect its so-called distensibility. What do you mean by distensibility? The ability to stretch.